Hi, my name is Erica Rudder, and the career presentation that I will be doing is for a public health program director. I based my interest level prior to research. I wanted to see before I started to truly research, although I do have the knowledge as to the basic ideas of a program director for public health. I wanted to see my interest level prior to research and post research. So since I have experience as a service standards director, even though the job is not the same, I have a lot of interest in overseeing a team and working in that sort of dynamic in my future. I like to work on different projects rather than just focus on the same one, whether that be just focusing on one company and just one product or whatnot. I would rather have the interest in going to different communities and developing different ideas. I like being active in my community, and making a positive change has always been my goal growing up. I just want to be the change that I have seen has been needed, and just going forward, going from there, finding a job that really fulfills that need. And I'm interested in working with government and hospital officials. It has always intrigued me to work on that level and experience things from that point of view. And I like different topics that will allow me to be diverse in my ability to communicate with others. Different communities have different people, different populations and whatnot, and I want to constantly challenge myself and change my communication with others. When researching a program director for public health, these are some of the job requirements I came across. As far as education, it's definitely highly recommended to have a bachelor's degree or higher. Many jobs require a master's degree when I was looking online through Indeed and whatnot. And public health administration bachelor's slash a master's degree, or public health bachelor's or a master's degree seems to be what is required when applying for a job like this one. And as far as experience, just a lot of working with community healthcare agencies and outreach programs and volunteer time. It's holding responsibility for community contacts, showing that you have experience in doing that. Administrative responsibilities in public health settings are also a huge experience that is looked at when I was researching. And it usually takes about 3 to 5 years in public health administration to be able to receive a program director job. Some key characteristics that come with a job is organization. And like I said, my interest is managing different things and different projects. And this is one of the things is organization is super important in this job, as they will be managing many different projects, handling different corporations, employees, just having the ability to stay organized. Leadership is a huge one. As being a director, you are directing others and you are looked up to and you are a leader. You're overseeing a team of workers, and I believe that quality in a job is something that really drives me of holding a huge leadership position. And good communication is also a key characteristic for this, as you will be in settings with medical professionals, government officials, and community coordinators. You will even be talking to community members. So just the ability to communicate and grasp different people, different topics, and whatnot. Some expected job duties when I was researching, this is also something that I found to be the most intriguing. I wanted to know what exactly that comes with being a program director. And some things I found was developing departmental budgets and directing funds to appropriate programs. You will have donations, you will be dealing with all sorts of different types of money, and being able to direct those in the right direction is hugely important in this job. Reviewing public health data while determining strengths and weaknesses. This can come through creating ideas for an intervention or any sort of program that's going to make a change, it's important to be able to know how to look at data. Communicating with public health employees to understand factors that are affecting communities. This is a lot of outreach, a lot of talking to others, giving calls and whatnot. Ensuring public health employees are following state and federal health laws. This is essential in this sort of setting, and this is something I definitely expected, is you were expected to hold these standards that you were going to project and educate others on, so it's important that you oversee the team that is doing the same. Some challenges of a public health director that I saw was a lack of communication from programs when it comes to the outreach and looking for any types of donations or participants, things like that. There's always going to be a lack of communication from some end, and this isn't going to be every experience, but through a lot of things I've read, a lack of communication. It's going to happen. There's going to be no responses sometimes, no answers, and that's where you keep building and keep going. Overwhelming circumstances, definitely as a public health director, I saw this hugely as one of their challenges. Example being coronavirus and having to deal with that huge change and different emotions from different people, whether that's personal or from a different level. A lack of public health workers in certain locations. Public health is an up and coming topic and interest through all different sorts of populations. While it has always been evident, it's always been there, it has now become that much more important, especially after coronavirus, that people acknowledge public health and the prevention methods that are aimed at and towards. And then a general disbelief in public health. I saw a lot of reviews and whatnot that some people choose not to believe in preventative health care, which is obviously a choice by choice thing, but this is a challenge that public health directors have. And high pressure medical situations, especially when it came to the coronavirus, when doing research and whatnot, it was critical that this sort of research was done in a timely manner, and program directors were helping communities prepare better and going forward in the future, hoping for better preventative measures. Some rewards of a public health director that I saw was a consistent salary with the potential of a pay raise. There are many jobs on the market that have a consistent salary but have no potential of raising it or growing within it, and that is what public health is. It is constantly growing within yourself and within the field. Health insurance is a huge reward. It is a healthcare topic. It is a healthcare need. So obviously it would come with some health insurance. With the potential of money value bonuses is exciting, and knowing that if you put in the time and work to be able to produce these sorts of interventions or programs, that there is a potential of a bonus. And the most important one, obviously, that I found is making lasting impressions to better society. That is just a personal reward. That's a good feeling, and you see it as a reward. An average salary that I saw for public health care directors, the start salary average was about $44,000, and the average salary overall would be about $72,000. But the potential salary as an executive director would be around $150,000 a year, which shows the room for growth and to keep building and keep growing. And now my interest level after research. The educational requirements were the only thing that threw me off, just as I am not even done with my bachelor's degree. I will be finishing in December, thinking about having to have that next step of a master's degree, overwhelmed in the moment, but knowing that if it is my drive and it is the career I want to have, that I will be able to make it work, and I will do the schooling and I will enjoy it. and it seems very interactive with many different people, which was my prior interest, was seeing if that was true or not. And the internships in the field are just extremely intriguing, and I look forward through these next 6 months of my capstone class, and I will be writing a senior paper that I am able to learn more about public health director positions, and hopefully have one day.